the last 24 hours, we have identified 967 new cases of COVID-19 in the province and completed more than 16,000 new tests. That puts our current positivity rate at about 5.8%. There are currently 806 people in the hospital, including 136 admitted to the ICU. Sadly, 21 new deaths were reported to us in the last 24 hours. Every health zone in Alberta had at least one person included in these numbers. My deepest sympathies go out to anyone across the province who is mourning the loss of a loved one. In our schools, there are currently active alerts or outbreaks in 12 schools, or about 0.4% of schools in the province, with 15 cases in total.
As of next Monday, January 18th, outdoor social gatherings consisting of up to 10 people will be allowed. We have to encourage everyone to still continue following the health guidelines during outdoor social gatherings. And what does that mean? It's wearing masks, it's keeping at least 2 meters apart, and it's refraining from using any indoor facilities while gathering with other folks. Indoor social gatherings, let me be clear, are still not allowed. Also, starting January 18th, personal and wellness services may reopen, but by appointment only. Now, these services include businesses like hair salons, barbershops, aesthetics, manicure and pedicure businesses, reflexology, piercing and tattoo shops, and other of our many different personal and wellness services businesses throughout the province. Appointments should be limited to one-on-one services, and businesses and clients are expected to keep following the public health guidelines. We are also easing restrictions on how many people can attend funeral services. We're raising the limit to 20 people, but still, funeral receptions are still prohibited.
What we need to see is continuing reductions in our hospitalizations and ICU with respect to that target of decreasing the impact on the health system. That is absolutely essential. We need to see a reduction in our new case numbers and a reduction in our positivity rate, as both of those two indicators help us understand what is coming with respect to people who will need hospital or ICU care. So again, those are our early indicators, and the hospitalization ICU are later or lagging indicators. When we have very high numbers, it's important again to see our R value below 1 as low as possible to indicate that we're dropping quickly with respect to our very high numbers going lower. And so those are the metrics that we're watching to make sure that we're monitoring the impact of both going back to school that happened earlier this week and then next week with the changes that were announced today, because ultimately the changes need to be done in a very slow manner so that we can monitor them, and how it impacts our overall case numbers is up to all of us. If we continue to follow those basic public health measures in all of our activities, including these new activities that have opened up, we can continue to have a downward trend at the same time as enjoying a few more activities in a safe way. And there still are rules in place for those personal services even when they reopen on Monday. When we looked at all of the things that we had to close in December because our case counts were moving very quickly to escalate week over week, and coming close behind was the hospitalization and ICU impact, which of course we've seen continue to escalate throughout the month of December. And so when we looked at all of the things that we had to close at that point in time in order to bring our numbers down, when we were considering what we might be able to reopen first, we did look at the evidence of transmission in the different settings that are currently closed or have significant restrictions in place. And based on our own data, as well as the findings that have been published around the world with respect to what settings have the highest risk of transmission, where there's documented evidence of that risk, and categorizing all of those, we in Alberta, and this is consistent with other jurisdictions, and as I mentioned yesterday, we have not seen significant transmission in those settings. In December, we did have to include them in the list in order to reduce the number of close contacts that Albertans had with each other on a daily basis. And as we were discussing the possibility of what things could be opened, the things that are being announced today were part of my recommendation based on the evidence, based on the levels of transmission that we have seen in different places. And our trend today is very different than our trend in December. Our trend in December was escalating quickly, and our trend today is coming down in a reassuring way.
All of these activities that are affected by the measures, all of them have different levels of risk. And I use the example that outdoor social gatherings have a different level of risk than indoor social gatherings. And here we see, as Dr. Hinshaw pointed out, that personal services have a different level of risk, and one that with our case numbers, while we need to still press upon Albertans to continue doing what they're doing, to continue to limit the spread in their community, and Albertans are doing a great job. Our rate at this point is below 1. We need it to continue to drop. That's really important for us. But as it is below 1, as our hospitalizations are starting to come down on a provincial-wide level, and the ICU admissions as well, that at this time that this is a level of risk that with these metrics, that is one that we can start to change. Now, there are still restrictions, though. Remember that at this time we still are doing personal services by appointment only, and folks have to still continue to follow the public health guidelines during those services, like wearing masks. So important for us to remember there's still restrictions on personal services, but this time we can allow them to open for appointment only. This is us continuing to do what we've always promised throughout the pandemic, which is to look at the data and to make decisions that are targeted, that are minimizing business disruptions. And that's exactly what we've done today, what we've done throughout the pandemic, and what we're going to continue to do going forward.